Well, hello everyone, and welcome to this Fireside Chat with Dr. Dirk Richter. This is one of the Fireside Chats with global leaders in healthcare, which we'll be showcasing at Giant Health event. It's a pleasure for me to have a chat with Dirk, who's a colleague, a friend, and also someone who's been working in the healthcare system for many years. His current role is a senior advisor to the Abu Dhabi Department of Health. He's come from a background of being a trauma surgeon in Germany, and then he went to management of hospitals for many years of his life before he was posted to Abu Dhabi to work with their Department of Health. So he has great insights into healthcare innovation, into what's required on a macro level across the country and across healthcare systems. So Dirk, thanks so much for joining us.
Hello Shafi, I'm happy to be here. Thank you for inviting me.
So, Dirk, I've spent a lot of time, of course, in the Middle East, and I've worked a little bit with the team there. Can we just give our audience an overview of the current healthcare system in Abu Dhabi to get a flavour of what it's like at the moment?
Yes, of course. Yes, Abu Dhabi is one of the 7 Emirates, the biggest one of the United Arab Emirates, and of course also hosting the capital. And actually, I think looking at the region around us, we are a little bit ahead since we are the first one to have health insurance for a little bit more than 12 years now. So everybody has got health insurance. And what we try to do in terms of healthcare is to attract international as well as local providers. So for example, opened in 2015, we opened Cleveland Clinic Abu Dhabi, which is really a subsidiary of Cleveland Clinic with all the innovation and all the healthcare Cleveland Clinic Ohio can offer. Recently, Mayo Clinic joined as well, but we also have local or more regional groups like NMC or BPS Healthcare. So all in all, it's a really vibrant healthcare system. And Department of Health tries to reward people delivering quality in healthcare, introducing innovation, and yeah, of course, we also have the issue like everybody to manage costs. But I think we do it in a quite proactive way.
Yeah, so it's great because you've got a relatively small population. You've got quite a mature healthcare system with insurance-based models, and you've got amazing hospitals like Cleveland Clinic and Mayo, which are really world-class. And so what an opportunity, of course, for us to learn from what you've been doing in Abu Dhabi. Of course, we're all troubled by the pandemic, Dirk. We all try to find solutions. And one of the things I was really impressed about over the last 9 months was how the Middle East, Abu Dhabi in particular, were managing this problem compared to other countries. So can you give us examples and just tell me about the story around the pandemic and what Abu Dhabi has done specifically to overcome some of the problems and challenges that we've all faced?
Yeah, I think first of all, of course, we are a region really at risk since we are between East and West and around 200 nations living in Abu Dhabi. So everybody traveling through the UAE and through Abu Dhabi. So I think it was key for us to react quite early. In March already, first of all, we built huge testing centers, drive-through. Now I think we are the country with the highest testing rate per capita all over the world. So more tests than population. And so at least data are solid, whatever we publish and we know about the people. And then we quite early started to really isolate people. I mean, in the beginning, we were even able to really put everybody being tested positive, either in a hospital or in a hotel, to really take them away out of the communities. We also did quite a systematic approach regarding our labor camps, of course, where many people live in this relatively small environment. So I think all in all, it's about really quite a consistent way of isolating and, of course, testing again and again in order to have accurate data and be able to follow patients and everybody being tested positive. So that's basically...
Yes, that's great. So one thing I want to pick up on there is testing. So one thing is I think Abu Dhabi did really early on, and the UAE as a whole, is somehow get access to mass testing. And you realize very quickly that was something that was going to be essential in managing the pandemic. So how did you get that testing? Was it done internally? Was it external tests that you were getting? I mean, how is that you achieved that compared to other countries that struggled to test their population to the degree required to manage the pandemic?
Yeah, of course, first of all, it was a giant sourcing approach to get all the tests in. And then we really shifted the scope of our public hospital group called SAHA, they usually operate hospitals and everything, and they were really mandated to build huge testing centers. So for Abu Dhabi, but also for the rest of the country, and it's drive-through, of course, the throughput of enormous throughput. So actually, that was the reason to really build an infrastructure. And of course, for us, next step is to build a similar infrastructure for vaccination for the future in order to take the next step. But it was really mandating a public group. And then, you know, I mean, we're always talking about private initiatives, and that's something very important. That's what Abu Dhabi aims at as well. But in this case, it was also very helpful to have a strong public group being able to deliver this very quickly.
So I'm guessing the fact that you had quite a mature system set up quickly in terms of testing, there should be no problems with vaccinations because you have the infrastructure already in place or the skills and know-how. Is that right, Dirk?
Yeah, yes, of course. I mean, what we try to do, of course, always be one step ahead. Now we have a also big clinical trial with an inactivated virus, registered around 30,000 people in Abu Dhabi only, starting I think in July already. And of course, the next step for us is now, of course, we're looking all over the world, have a lot of corporations, looking at all the vaccines available. But actually for us, it was important to also be very quick in order to get the vaccine and to build an infrastructure. And that's the next step for us.
And we've seen, of course, the kind of hopefully release of 3 vaccines in the next month or so, which will hopefully improve the outcome for many people going forward. One of the things I'm really impressed with Abu Dhabi is the fact that you have around about 50, I think, healthcare institutions that are now becoming more connected. Okay, so can you tell us more about that? Because I remember coming to the Department of Health and seeing a lovely dashboard on collecting data, analytics in real time, focusing on how to manage the healthcare system better. Can you elaborate on that, please? The kind of the Malafi link with electronic health record, with data, analytics, and the dashboard, Dirk.
Yeah. Yes, I could start. I mean, with something everybody knows, data is the new oil, and we are very experienced in oil, so that's the starting point. No, I mean, actually, already when we started health insurance, we made sure that all kind of insurance claims, so whatever happens in the market is going through DOH, so the Department of Health. So we always get copy of every kind of service being delivered in the market for almost 12 years now. So that was a really first step that gave us support in terms of planning and everything. And what we are doing right now, or almost done, is that we also have all electronic patient records in one database. It's called Malafi. It's a system we started with the public sector, but enrolled all the private providers as well, one after the other. So, I mean, it's not fully completed. And of course, whenever you talk about data, you need to make sure that quality is accurate and so on. So that's an ongoing journey which never stops. But still, we will be able to have all information in one database for the entire emirate, which of course helps us to avoid duplication in terms of too many X-ray and all the things you aim at, but also helps us to do more analysis for those data. And this is again, of course, also very valuable for all kind of research, which would be the next step as soon as this is done.
So I love that idea. You collect data because it's insurance model. You have that data already. Now you're essentially connected to a central healthcare information exchange, the HIE as we call it. So yeah, that's been expanded. Has that helped you manage the pandemic in a different way because you have really accurate and real data? Has that helped you in any way, Dirk?
Yes, of course. I mean, it helped to link those data. It's all more or less linked to our ID cards. So of course, all kind of testing being done, all the data we needed to respond to the pandemic. It's of course quite helpful, and it was almost done when the pandemic started. So it helped us a lot to of course oversee the population, and in particular for us. When we started all the testing, but also, of course, for vaccination, is to identify the risk groups. And that was something where this was quite helpful, since, I mean, of course, we had the same issue like everybody around us. The number of tests was limited in the beginning, and of course the same is if you think about a vaccination strategy. You can't vaccinate everybody in 2 days, so you need to have priorities, and that's something where those data can for sure help us also for the next step.
Yeah, I love that. I mean, look at this. You've got a national ID system, so you have that inbuilt. You have now a connected data system, database, or electronic health record. You can actually look at risk groups very quickly, isolate, move them around, and this is it's amazing. So I really like the whole model that you've created already, and hopefully other countries can learn more about how you've managed the pandemic and how we learn going forward. Let's go back further around the other roles that you have. And one thing I'm really impressed with Abu Dhabi is its role and its passion for innovation. So I'm going to leave that question open to you, Dirk. Talk about innovation as a whole in healthcare across Abu Dhabi, because I think it's fascinating.
Yes, I mean, the whole journey started some years ago when we realized that all the research we do ends with sometimes some of the amazing papers, but there was not really much output in terms of patients really benefiting from this. And since, of course, we are still quite a young country, we'll be having our 49th birthday in some days. So we thought about there is a need for government to enable certain things. I mean, we still believe innovation is something for private sector, for people coming in, aiming at earning money and doing things for passion. But still, as a government, we started to build an ecosystem for innovation. So we thought about what can government, in particular the healthcare regulator, do for innovation, and we really started to dedicate a small team, but still a very passionate team to work with innovators, to help innovators to land in Abu Dhabi, to link them to all our hospitals, all our corporate partners, and really prepare a landing platform for innovators in Abu Dhabi. And I mean,
Yeah, no, it's amazing. So I want to explore that a bit further with you. So I've been lucky enough to, of course, experience that firsthand with you. Tell us more about Hub 71 and its role in healthcare innovation.
Yeah, Hub 71 has been created as an ecosystem for innovators to come to Abu Dhabi. So it's not sector specific, but since we are present with a strong team in health tech is one of the main pillars. So what Hub 71 tried to do is to bring all resources together. So there is co-working space and everything, an infrastructure for startups to come. There are corporate partners around, and there are also access to venture capital funds who are part of this. So it's a big innovation hub managed by WeWork with all resources required. And as a Department of Health, we are the first government entity, the first regulator to move in 1.5 years ago already, in order to really provide startups with all they need in order to be successful in health tech. And sometimes when people ask me, so what are you doing? It's sometimes like a translation service between startup and innovator language and government. You know, sometimes there are two worlds clashing with each other without any productive result. And what we try to do is really, in terms of healthcare, is of course something highly regulated. So we try to support innovators with new business models to find a way to get reimbursed in Abu Dhabi, but also find a way to get a license and whatever is required in order to run a business. And yeah, that's something like a translator service, trying to align regulation and existing or new business models. And yeah, it has been quite successful. The number of innovators and startups being licensed in Abu Dhabi, working in the market, yes, is continuously increasing.
Brilliant. And the fact that you've encouraged innovators coming to Abu Dhabi to be a kind of this hub of creativity, and also to allow them to access the healthcare system, allow the regulations to be overcome, and then license to be approved. And I think that whole model is really attractive for a lot of the countries around the world. So you're, of course, intimately involved with the innovation part of it, of course. Can you give us an example of how many startups in healthcare have come to Abu Dhabi? What kind of startups? And perhaps examples of how many of those have been kind of translated into the clinical practice?
Yeah, I mean, there are, of course, very different kind of startups right now. I think we're talking about a number of around 50 startups being licensed in this ecosystem. Of course, I mean, you're talking to many more. The long list would be something like a lot more than 100. I mean, actually what happened during COVID-19, during the last month, of course, that there's certain people really benefited from the requirements. For example, all startups delivering remote care, which means, of course, telemedicine services, also IoT devices that would enable to record vital parameters from home. We have a lot of people who are doing some kind of risk assessment. For example, one of them even joined and partnered with our national airline, Etihad Airways. Now, if you go to their website, you can find the startup and risk management tool for the pre-boarding process. So all forces somehow aligned, and many people around mental health. I mean, we realized very soon that mental health is an issue in those pandemic days. So there are many startups who really shifted their business more towards mental health and mental well-being. And COVID-19 solves a variety of things. We have one similar to Uber with an application where you can book doctors to come home, all those different services.
So that's interesting. So COVID has driven some of the changes in what startups you need at the moment: telemedicine, remote care, Internet of Things, monitoring, I guess, remotely. And I love the fact that you're thinking about well-being, mental health. Mental health has always been a difficult one in the Middle East, of course, and parts of Asia. It has a different kind of connotation for a lot of people, right? So in the future, do you think some of these mental health apps or solutions are going to be amplified for the vast population in terms of mental health problems?
Yeah, of course. I think, I mean, we can discuss the rest of the day about what's the new normal, but for health, it's very clear. Like, I mean, your children will tell you, so why should I go back to school? Homeschooling is working perfectly fine, and we expect the same for our patients. I mean, right now we are just thinking about, so what kind of services and how will healthcare be delivered in future? And it's very clear that many of the services that have been introduced during the pandemic will continue, in particular those remote care things for mental health and others. And what we also realize in terms of mental health is the fact that there are not many applications in Arabic. So that's our market somehow. I mean, there are many things, of course, in English and other languages, but for the Arabic speaking population, things made in Abu Dhabi have a great potential of going across MENA region, and we're talking about 400 million people speaking Arabic around us. So that's, of course, one of the focus areas for us, people delivering things in bilingual, usually Arabic and English, but Arabic, of course, has a huge potential across the region.
And how have the patients responded to the pandemic and your innovation? You have a fairly young population, I think, in the Middle East generally, who are perhaps tech savvy, more digital literate. Has that helped you in the way that you're shaping healthcare in Abu Dhabi itself?
Yeah, I think so. I mean, of course, in March to May, June, many providers were just mandated to deliver services remotely. But I think a huge number of the population are very much keen on digital services. So I think it helped a lot, since at least everybody has a mobile, is used to doing e-government is one of the big things. So everybody is used to using the mobile for very many things. So I think it helped, of course. But still, of course, there are patients who love to go back to the healthcare facility as soon as they can. But in general, I think it helped.
So Dirk, you mentioned earlier about your, I guess, small snippets about research in Abu Dhabi. And I've seen that now that you're creating something new, or you're trying to expand your horizons or bring partners in. Can you tell us a bit about your kind of research, I guess, project, or your future that you're trying to create in Abu Dhabi?
Yeah, of course. I mean, for us, first of all, research, translational research, innovation is very much connected. I mean, of course, when we started to think about our research strategy, the region was around 3 million population. The entire country is 10 million. So you think about, so what should you do? I mean, should you duplicate efforts from countries that have maybe 10 times the population or even more? And so for us, it was very clear. Of course, we have certain challenges, like a number of chronic diseases, diabetes, obesity, the number one. But what we thought about, what if we focus on research and fund research and promote research, we should focus on things that have a high probability of ending up with products and services that are useful for the population. So products, not gigabytes of papers. That was the first hypothesis we had. Let's try to, and doing that, of course, there's a need to closely link research and innovation. And of course, we are quite lucky to have big and international providers, as I already highlighted, like Cleveland Clinic, Mayo Clinic, with a number of really smart people who come here, do clinical work, but also to want to do something more, do research, do innovation, develop products. So for us, this is something that we really look at holistically. And yeah, my research colleague is sitting next door, so there's very much communication, and we try to really enable things, starting with clinical research but really getting products out of it very soon. So that's our philosophy of how we look at research and link it to innovation.
Well, I look forward to seeing how that develops, of course. And what I've also noticed about Abu Dhabi is the way they collaborate with other partners. They have this wonderful attitude saying, look, we need to bring other expertise in. Where do we go? How do we find that? And they're really good at reaching out and creating those collaborations. Can you tell us about some of the key partnerships that you've created for healthcare and also for your research?
Yeah. I mean, the first thing I think also to understand the history of the whole nation is that it was built through partnerships and through looking east and west in order to identify best practice, which is not only healthcare or health tech, but everything. So, and that's what we usually first of all do. And it was quite interesting for me as a European citizen to come here a few years ago and see, of course, Europe and US, but we also look at Singapore, at Korea, at Japan, and of course China as well. So that's one of the things. And for innovation, of course, for example, this Hub 71 is a joint venture between Mubadala, our sovereign wealth fund, as well as Microsoft and SoftBank. So again, an international place for people to come and expertise from different regions. For health tech, we, for example, partner with Plug and Play in an acceleration program in order to get access to international markets. We're happy to work with you, Shafi, as an advisor and supporter in terms of your networks and your expertise. And there are many, many more collaborations that help us to build an ecosystem, but also to look at best practice all over the world. That's one of the key success factors for the whole country, not only for health.
Yeah. They embrace it. I just think that's really refreshing to see. And we all have different ideas, bring skill sets in, I think is the right answer. What we've seen during the pandemic is an acceleration. We've seen people coming in up faster. You want to innovate rapidly, and also to relax the rules and regulations, but to collaborate widely. And so I think your model tends to work well from that perspective. But I'd take it now just a few minutes to talk about the future, really. I know Abu Dhabi has a vision for the next 10, 20, 30, 40 years as part of its strategy. Can you share that with us, Dirk, where you are on your timeline? What's that vision of Abu Dhabi look like over the course of a period of time?
Yeah, of course. I mean, the first thing is it's quite far away, but still tangible. Is the 100 years of United Arab Emirates in 71. So that's why we looking at Hub 71 and others. So of course the vision is ongoing. And I mean, for health as a healthcare system, we want to be among the best in the world. That's very clear in terms of quality, in terms of access to healthcare. And for health tech, of course, the vision for us is to give everybody access to innovation. So we want our patients to really enjoy the latest kind of therapies and everything. And at the same time, from a more economic point of view, of course, I mean, you're always talking about health as a cost factor, as a cost center. We think that there is a huge potential for health and health tech to be a contributor to GDP. So those are the things that are driving us. And as government, I mean, many things have been driven by government in the UAE that built the country. But of course, the more the private sector can take over, the better. So we consider ourselves as enablers for very many things. In the long run, hopefully, the private partners will do much more than government would ever be able to do.
Yeah, I think you're right. The public partnership is quite important, crucial as we go forward. I'll ask you a question around education. Obviously, I was there, I think last year, and I saw your new medical school that was just being opened up. How are you going to be able to, in the future, ensure that you have the adequate education resources, the kind of the training required, and the level of experts within Abu Dhabi itself, rather than bring external people in? What's your plan for that, Dirk?
Yeah, so I mean, the whole country was built on education. I mean, the first thing the founders of this country did was really send people abroad to learn, to bring talent and capabilities back to the country to build it. Of course, now as a second step, it's important for us to have education and more educated people being educated in the country. So, of course, we opened the second medical school in Abu Dhabi. And we're also aiming at getting much more UAE nationals, Emirati, in healthcare. I mean, right now the share of healthcare professionals from the citizens of the United Arab Emirates is quite relatively low. So we are, of course, working on increasing this, making healthcare more attractive to the UAE nationals. And part of it is, of course, having education here in the second medical school in the country, or in Abu Dhabi. So that's one of the things. And again, in particular, the second one is so-called Khalifa University. They also have a strong focus on technology, which helps us a lot in innovation. So they have a technology innovation center, and now they opened a medical school. So there's a close link between two partners within the same university to really help us to develop things in healthcare and health tech.
So that sounds great. So it sounds though you thought about all of the various problems that you have in Abu Dhabi. You've gone about in a way that's strategic, that makes sense. You're collaborating, you're thinking about the future planning, you have a vision, of course, and of course, I think you're investing heavily into that future of healthcare. So look, Dirk, it's been a wonderful conversation with you. I just wanted to share what you are doing in Abu Dhabi, because, you know, we with this pandemic, we're learning we're a global community, and the way to go forward is to learn from a global community about what works, experiences, and shared common values. And I think you've been Abu Dhabi itself is, I think, an icon for a lot of us. I think that haven't seen it before, that what you do is actually very productive. Of course, come with challenges, resistance, and difficulties like healthcare around the world, but it is to overcoming some of the hurdles by allowing innovation to flourish going forward. So with that, I'd like to thank you, Dirk, for spending a few minutes with us and share your experiences and that of the Middle East and Abu Dhabi in particular to a wider community amongst the giant health. So thank you so much for joining us.
Thank you. It was a pleasure to talk to you again, as usual. Thank you, Shafi.
Okay, so you to get that conversation in, because we covered a bit about the pandemic. We could add at that point. I want to say, yeah. What's one key success experience that you had during the pandemic, and that then you can elaborate. Yeah. Is that it?
Something
okay.
Like this.
So we'll record that again, guys. The next bit. So 3, 2, 1. So Dirk, so during the pandemic, can you just illustrate some of the successes or experiences that you had that allowed healthcare innovation to flourish?
Yes, of course. Or actually, what we realized and observed during this pandemic, of course, there's certain kind of business models of startups, innovators that became key, like all kind of remote care services that were all of a sudden required in April, March, and during the upcoming months. And all of a sudden, and that helped a lot, innovation became a CEO task and really a must. Before that, we realized, of course, everyone was interested in talking to startups. Maybe they engaged with one or the other. But all of a sudden, CEOs realized there is no way to fight the pandemic with the conventional methods we had in the past. So they had to deliver remote services, telemedicine, and other things, all of a sudden from one day to the other. And this helped a lot, since this really was a key, CEO task all of a sudden, and then CEOs engaged with startups and pushed very much to get those solutions implemented. And all of a sudden, 6 months projects were done in 4 weeks, and so on. And a number of startups really benefited from this. And I think also as an impact for the long run, CEOs realize there is more than just the things they have done in the past. Is really also for the future. It's very helpful to engage with those people and to support innovation, to implement quickly in order to be fit for the future. And that was something, very supportive for many of our innovators, that they all of a sudden became key to fight the pandemic.
It's wonderful. What an opportunity for the startups and for the whole system to accelerate the pace of change.